Well, at this time, New York League is enhancing the lives of children who have been diagnosed with autism by providing a structured classroom environment that addresses their needs in terms of language and behavioral supports. And the way we go about doing that is we have an intensive training program for the staff that are in those classrooms, and that our cornerstone of that program is applied behavior analysis. And we use those principles in the rooms to just bring out the best in each child. And I think what's a little different about the way New York League approaches it is that we don't just have a program and make sure children fit into it, but we look at each individual child and then we tailor our program to meet exactly what their needs are, while relying on applied behavior analysis and all the richness it brings. So when a new family gets a diagnosis, especially if there's such a young age, the children, and sometimes the families themselves are very young, it can be very difficult for them. And New York League is a great place to be for that process, because one of the things that's so wonderful about us is we are a nurturing place. And so we have very specific and structured programs, but we are foremost a loving preschool environment. So even though sometimes we're very structured, we have a nurturing environment. We have lots of supports in terms of social work staff and psychology and people that will really walk them through the process, because it really is all new at that young age. And each of our individual schools and our home-based program are able to provide that to families. Over the years at New York League, one of the things that we've done is we've really changed the basis of our language program, especially in those classrooms. We've embraced this model called the verbal behavior model, and what it does is it really drives the programming from the child's motivation. Okay, so if you want something in your environment, any one of us, and we say something and ask for it and we get it, what we learn is that using our language is fantastic. It works for us. And that's what this model teaches our children, that you don't have to talk or use your sign language or your augmentative system because we, the adults, want you to, but you're going to use that device or that word or that sign because you see the benefit of communicating. And so over time, what we've seen is that because language benefits the children we work with, that they're more inclined to use it and they're more motivated to use it.